Okay, so here we're going to talk about our um, respiratory tract infections and focus on fungal infections. And here is an x-ray of a person who has an Aspergillus infection of their lungs. Now, fungal infections are going to have some um, factors that are important for their transmission. And two of the main factors are the ubiquity of the infectious organism. How prevalent is it in an area? So those that are found in soil, those that are found in hospital areas, those that are found on our bodies as part of our microflora are all going to potentially be transmissible. Also, another is the adaptive immune response. How immune competent is the person? Your adaptive immune response, which is your your T cells, are going to be very important for clearing the virus, especially your CD8. So immunocompromised patients are at risk. That's why nosocomial infections with fungal agents is a very high priority. You can have lethal pneumonia caused by fungal infections, so pneumocystis pneumonia, which is going to be caused by Pneumocystis jirovecii. This is a lethal pneumonia that is very common in patients who are presenting with acquired immune deficiency syndrome or AIDS. All right, so lethal pneumonia is again going to be primarily in AIDS patients. It's going to have an atypical feature because it's made by our Pneumocystis jirovecii, which is always a yeast. And so it has very odd-shaped, yeast cells typically are very odd-shaped. The plasma membrane is also going to be different. It has cholesterol, in its plasma membrane, not ergosterol. So any of those antifungal agents that target ergosterol production are not going to work for Pneumocystis jirovecii. This is going to be found in the soil, also part of the normal flora. This does not affect immune competent individuals because our immune system is able to clear this yeast very quickly. Here's a picture of Pneumocystis pneumoniae, pneumonia. You're going to get your alveoli filled, and you're going to have what's called a honeycomb appearance of your lungs. So you can see all these little dots. It looks like maybe a little honeycomb. The onset is insidious. It can be present for 3 to 4 weeks before it's even discovered. So fungal agents typically divide very slowly as compared to bacteria and viruses. And so they take time to develop into at a point where it will become symptomatic. Your manifestations are going to be tracheal pneumonia, cyanosis, hypoxia, a non-productive cough, very dry cough in many of the patients. So again, the x-ray is going to show that infiltrate, obviously it's a lung infection, you have decrease of oxygen, and for treatments, you're going to combine a series of antifungal agents for about 2 to 3 weeks for non-AIDS patients, or patients with AIDS, you can have a much more longer treatment regimen. Now, another fungal agent that can cause disease is Blastomyces dermatitis, can cause Blastomycosis. This is going to be transmitted by spores. These spores are going to cause initially a lung infection, and most people will be able to control the lung infection. However, this guy can also spread to the blood, and then you can get dissemination. It can spread to the skin where you get warty patches, as shown here. These are wart-like skin lesions. It can also disseminate into the bones. The prostates or painful swellings of the epididymis of men. Typically, males between the ages of 20 or 40 years are most common because this guy is found in wet soils, typically associated with hunting, fishing, hiking. And you can see that this is an image of the lesions in the actual lungs. Another is histoplasmosis. This is caused by Histoplasm capsulatum. This one is associated with soil with bird or bat droppings. So it likes acidic soils. It's going to be found in particular areas, so subtropical and tropical zones. In the areas where residents live, you can find antibodies for histoplasmosis in people because that means that they've been exposed. But again, if you're immune competent, your CD8 T cells will clear this infection and you will not be at risk. People who are at risk work in areas where there's bird and bat droppings, and they also have some sort of immune compromised state. Inhalation of your microcanidia are going to be cause your infection, and then they're going to spread. Histoplasmosis, again, for the United States, is going to be in the eastern side of the United States. It's going to be a mold outside of your body. It's going to turn into a yeast inside of your body. It's going to be able to infect the lymphatics. And most people are asymptomatic, and severe cases are usually going to be resolved spontaneously, unless, of course, you're an immune-compromised individual. Treatment for histoplasmosis is going to be antifungal, such as amphotericin B. HIV treatments can include the azoles, itraconazole or ketoconazole. The lab diagnosis is going to be a potassium hydroxide wet mount showing Blastocanidia. So this is an example of our Blastocanidia. For people who have disseminated, you can look at their bone marrow and see if they have macrophages with Blastocanidia inside of them. And they can also have this very typical pear-shaped microcanidia. Another is our valley fever, coccidioidomycosis. This is going to be transmitted by arthrocanidia. Basically, your fungus is going to shed its septate hyphae, and the septated hyphae become arthrocanidia, which is similar to a spore, and they can travel very far. Your arthrocanidia will form spheres inside of your body, and these will grow, and phagocytosis, it's very hard for your immune system to eat these. Now again, your immune system will usually clear these infections. It can be treated again with some antifungals. However, you can get dissemination of this to the skin, as shown here with erythema nodosum. So valley fever is going to be in southwestern United States, very dry, very warm climates, Mexico and South America, Central South America. It is native to the San Joaquin Valley of California. You can use smears or cultures or blood tests in order to diagnose coccidioidomycosis. And then finally, Aspergillosis. So the canidia of Aspergillus are going to reach the alveoli. And again, these canidia are their spores on the outside, so they have naked canidia. These guys are going to not cause any problems with immune-competent people, but are going to cause significant diseases in people who have a compromised immune state. There is amphotericin B that can help, but there are really no other treatments. Diagnosis is also very difficult because the mold is everywhere, so contamination is a problem in samples, so it's very important to make sure that you take multiple samples and you find Aspergillus in all of those samples from the patient.